Hey, everybody, and welcome. This is Nurse Eunice with Florida Training Academy, and today I have a great surprise for you. Today, our wonderful interns, yes, they're here on the video with me. These are our secret soldiers. These are the ones who help us with all of our presentations and slides. So when you're like, hey, I want to learn about anatomy and physiology, I want to learn about medical terminology, these are the ladies who help us get things done at Florida Training Academy. So we're so appreciative of them. And so, Damani, Shelby, and Alexia, go ahead and wave to everybody. All right. And so, in today's video, everybody, we're covering Pet Emergencies 101, first aid review for pet lovers and their caregivers. Look, we know it's the holiday season, and those kids are going to be asking for those pets, those animals. Make sure they watch this video before you provide them with an animal, a fur baby, just to make sure they're aware. And hi, Mila, it's great to see you. So that's our introduction. So, according to the American Animal Hospital Association, 1 out of 4 pets could be saved if just one pet owner in every household learned basic first aid and CPR. So, pet emergencies can happen at any time, and immediate action can be crucial in preventing severe injury or death. Common emergencies include choking, shock, and heat stroke. Shelby, would you please read this slide?
In fact, over 92% of pet owners are not familiar with pet CPR techniques, even though knowing these skills could save their pet's life in an emergency. This practice test is designed to introduce pet lovers and veterinarian care enthusiasts to essential pet CPR and first aid knowledge, helping ensure the safety and well being of their furry companions.
All right, and we have a lot of viewers who are saying hi, hello, everyone. All right, Zalexia, can you read this slide?
If you are passionate about keeping your loved ones, both human and furry, safe, you've come to the right place. Whether it's CPR for humans, pet first aid, or emergency preparedness, we've got you covered with practical and easy to follow tutorials. Don't forget to like, share, and subscribe to our channel so you never miss a chance to learn how to save a life. Spread the word and help others become heroes for their families and pets.
Perfect. And so, everybody, here is our disclaimer. We are not veterinarians, are we, team?
No, we are.
No. And so the information provided in this video is for educational purposes only. For any medical questions or concerns regarding your pet's health, please consult with a licensed veterinarian. Always seek professional advice before taking action in any emergency or medical situation involving your pet. And here are some additional resources. So if you think that your pet has ingested something poisonous, maybe a poisonous plant or a poisonous food, you can always go to the Humane Society. And so go back, watch this video again, so you can make sure that you either take a screenshot of this link or you can enter the link and search for it on your computer. But it will give you a list of poisonous plants and foods. You can also contact the ASPCA Animal Poison Control toll free at 888-426-4435. And then once we get through this video, you're going to be like, oh my God, I learned so much. So if you need a first aid book for pet CPR, if you need a first aid kit for your pet, if you need additional supplies, of course, we have that on our Amazon store. And our Amazon store is at amazon.com/shop/Florida Training Academy. And let's begin. If I could please get you, Damani, to go ahead and read this slide for me.
Rep your pet. Are you a dog, cat, bird, or reptile lover?
All right, so Kelly, Mila, Paul, Love, Marcia. I'll make sure I answer that question via the community section, Mila, about the Zoom meeting for Saturday. But do you all have any pets? And if so, are you a dog, cat, bird, or reptile lover? And we'll be waiting for those responses as we go ahead and read out the next slide. So let us begin our practice test. Thank you for joining us today. Be sure to engage with us by entering your answers and thoughts in the comment box below. We're excited to hear from you. Let's see how well you do on this pet CPR and first aid practice question. All right, question number 1, Shelby, can you read it for me?
What is the recommended rate of chest compressions when performing CPR on a medium-sized dog? Is it A, 60 compressions per minute, B, 80 compressions per minute, C, 100 to 120 compressions per minute, or D, 150 compressions per minute?
Awesome. And we'll give you a few moments to answer those questions. And while you're answering those questions, let's see what type of animals we have. And looks like Marsha passed her exam. So congratulations, Marsha. Everybody, if you haven't done so, please congratulate her. And so Kelly said she has a dog and a cat, and Miriam has a toy poodle. Kelly has 2 dogs. And then on top of that, Kelly says that the answer is B. Mila says it is C. And then let's see here. Any other responses coming through? We'll reveal the answer in 3, 2, and everybody, what is the answer?
C.
It is C. So just like with human CPR, whenever you're performing CPR on an animal, it is 100 up to 120 compressions per minute. And here's the rationale. For medium and large dogs, compression should be delivered at a rate similar to human CPR. This ensures this ensures proper blood flow during resuscitation. And you can always go back later and look at this image. But whenever you're performing CPR compressions on a medium to a large size dog, you want to make sure that the dog is laying on its right side. So the left side is going to be up, and wherever the upper extremity, wherever it bends at, I'm going to say the elbow, that's where you want to place your hands. And you're going to compress about 2 inches. And now while you're doing these compressions, this is something I want you to be mindful of. Just like with human CPR, you have to call for help because there is no rescue team for animals. And so when you're calling for help, you got to make sure that if the veterinarian can't come to you, that you're calling someone who can transport you to the vet. Maybe the dog ingested something that was poisonous. But CPR does work. It helps keeping blood flow to the brain. It's just that an ambulance isn't going to come to you. So be thinking about that. We know that you love your furry family members. So be thinking about what you do in the event of a incident such as cardiac arrest in a dog. Question number 2, if I can get you to read this one for me, please, Damani.
When performing CPR on a cat, where should chest compressions be administered? Is it A, on the left side of the chest, just below the front legs? B, at the base of the tail? C, on the right side of the chest? Or D, on the left side of the chest?
All right, so think about it. Thank you so much, Damani. Think about it. What did we just say about dog CPR? How should they be positioned? What side should be down? What side should be up? And if you think about it, it is quite similar for cats. So let's see what answers we know. Oh, so Kelly, for a small dog, let me show you now. I'm going to go ahead and put my camera back on. For a small dog, you would compress on both sides. So if the dog's really smaller, say you have a toy poodle, this is how you do your compressions. 1, 2, 3, 4. So that would be for a smaller dog. Thank you for pointing that out, that I did not discuss that. So everybody, the correct response is A, on the left side of the chest, just below the front legs. Rationale. In cats, compressions are administered at the point just below the elbows on the chest, targeting the area of the heart. So if you chose A, you are absolutely correct. All right, so, and this is an illustration of how you perform CPR on cats, a comprehensive guide. And as I said before, you always can take a screenshot, or whenever you come back and watch the video again, you can read that in more detail. Question number 3, I think we're on you, Shelby. Would you read it for me?
What is the first thing you should do if your dog is choking? Is it A, perform a tracheotomy?
Yes, ma'am.
B, start chest compressions? C, check the mouth for obstruction? Or D, give rescue breaths?
All right, let's see what we have. And then Mila, I'm going to put my email address in here because I think you're having additional questions and I may have missed it. So you all, if you have additional questions regarding something that we may not have covered yet, go ahead and send an email to us. Okay. And that is admin@fltraining.com. And looks like Mila has C, and she is absolutely correct. So what you want to do is you want to check the mouth for an obstruction. Always check the mouth and throat for visible blockages before performing any other intervention. Dislodging the object could resolve the choking. And so now we're on you, Zalexia, number 4.
As a home health aide, you notice that your elderly client's pets appear malnourished. What is the first course of action? A, feed the animal immediately. B, report the observation to your supervisor. C, take the pet to a veterinarian without informing anyone. D, ignore the situation as if it's not your responsibility.
All right, so let's see what our team of caregivers. So that's right. We not only save human lives, we also have to think about our patients, our clients who have furry family members. We have to be able to take care of them too. And so we'll reveal the answer in 3 seconds. 3, 2, and yes. Great job, team. If you selected B, you are correct. You want to report the observation to your supervisor. Home health aides should report any concerns about the client or their environment, including pets, to their supervisor. The supervisor can take the appropriate actions, such as contacting another family member or social services. So remember, if a client's having a hard time taking care of themselves, they're probably also having a hard time taking care of their pet too. So question number 5, which of the following foods is highly toxic to dogs and should be avoided? Is it A, apples, B, carrots, C, grapes, or D, rice? What do you think, team? Let's see if we have any responses coming through. It looks like I see a lot of B's, and I'm not sure if that was from the previous question number 4 or if it's from question number 5. So we have B's. I see a C. All right, so Mila says C, Kelly says C, revealing the answer in 3, 2, and yes, you're absolutely correct. So the response is C, grapes. So the rationale, grapes or dried grapes, aka raisins, are toxic to dogs and can cause kidney failure, even in small amounts. Apples, carrots, and rice are generally safe for dogs in moderation. Ask your pet's vet for a list of safe foods. So don't just assume it's safe. You can always contact your vet for more information. It looks like someone's asking about the next live stream for nursing assistants or for medical, and we're going to be doing one on Friday evening and also one via Zoom on Saturday morning. Question number 6, which of the following is a sign of shock in pets? Is it A, excessive barking, B, pale gums, C, hyperactivity, or D, clear eyes? And then Shelby, I'll have you read the answer in a few moments. Are there any answers coming through, team? Yes, that's right. Kelly says chocolate is bad for dogs. Mila says B. And so this is going to be your turn to read. Let's see, it's Damani. What's the response?
B, pale gums.
All right, and what's the rationale?
Pale gums are an indication of shock, which can result from trauma or severe blood loss. Pets may also show
Lethargy?
lethargy or rapid breathing.
That's right. So let's look at these gums, everybody. We know that gums should be nice and pink. So let's say your dog or your cat, they're not behaving properly. They're probably going to be really tired, not as active. You can always look at their gums as a sign of their health. And so if the gums are not nice and pink, if they're pale like this, that is a sign of poor perfusion. You have to get that animal to the vet right away and figure out what is wrong with it. All right, question number 7. In which situation would you administer an abdominal thrust to a dog? Is it A, seizure, B, heat stroke, C, cardiac arrest, or D, choking? And this time I want my interns to go ahead and also enter comments into the chat. What do you think the correct response is? So it looks like Love says B, Marcia says D. And Love, that could have been from the prior question, and if so, I apologize. I see a lot of D's. Marcia, Miriam, Mila, and let's see if anyone else has entered an answer into the chat. We're revealing the answer in 3, 2, and you're absolutely correct. D, choking. So the rationale, abdominal thrust similar to the Heimlich maneuver can be used to dislodge foreign objects from a choking dog's airway. I want you to look at these different images. So number 1, raise those hind legs, utilize gravity to try to get that object out. And if you still can't get it out, you can always sweep inside of the animal's mouth. You can apply pressure. So you can, with the dog being on its four legs, you can go wrap your arms around it and you can do upward thrust on its stomach to try to relieve the obstruction as in image number 3. Or image number 4, you can try to hit the dog in the center of its back to try to bring the object out. But those are ways that you can help a choking dog or cat. Question number 8. What is the ideal duration for each rescue breath for a cat? Is it A, 1 second, B, 3 seconds, C, 5 seconds, or D, 10 seconds? And then Shelby, Alexia, you'll be reading the response for this one. All right, so let's see what's in our comment area. And Wilbur's a name I've not seen before on our live. So hello, Wilbur. All right. So Shelby, what was Mila's answer? Do you see it yet?
No, ma'am.
Okay. All right. So we have a couple of responses, and now is Alexia. If you'll go ahead and read the correct answer.
Answer is A, 1 second. The rationale is rescue breath should last about 1 second to ensure enough air is getting into the cat's lungs without overinflating them.
All right. And so I love this image because whenever we think about rescue breaths, especially with our animals, we oftentimes see that during fire emergencies with smoke inhalation. And you'll see the paramedic or the firefighter come out giving breaths to a dog or a cat. Once they are stable, they can put oxygen. So just like humans can receive oxygen via mask or nasal cannulas, we don't use nasal cannulas on the animals, but we can use mask on the animals. And that's what that image there shows. So if a dog or a cat is having respiratory issues, we can also provide them with supplemental oxygen. Question number 9. This one's yours, Shelby.
Which of the following is an immediate action for treating a pet with heat stroke? Is it A, wrap the pet in blankets, B, give them ice, water to drink, C, move the pet to a cooler environment, or D, rub their belly?
All right, turn the cameras on and let's see what's in the chat. So let's see what comments we have. All right, so do you think is A, B, C, or D? All right, so Lexia, what do you think the answer is?
I feel like C.
You feel like C, put the pet in a cooler environment? All right, let me check the chat. Zalexia, I think you're right. Do you see how many C's are in the chat?
Oh.
All right, so great job, team, revealing the answer in 3, 2, and 1. It is C, move the pet to a cooler environment. Rationale, heat stroke can be deadly. Look, we live in Florida, so it gets really hot. And I feel so sorry for those pets who have these extra energetic owners who are out there running in the pavement, on the pavement when the concrete's like extra hot. You're not supposed to be doing that. So rationale, move the pet to a cooler environment. Do not let the pet walk out on the hot concrete, especially during the summertime. Immediately move the pet to a cool shaded area and offer small amounts of room temperature water to prevent further harm. You don't want to give cold liquids when somebody or a pet is overheated because that can also take their body and put it into shock. Question number 10. Which common household plant is dangerous for cats and can cause kidney failure? Is it A, aloe vera, B, snake plant, C, lavender, or D, lilies? And then I think Shelby, if you can read the answer for me in a few moments. Speaking of which, Shelby, give me a guess. What do you think the answer is? Even if you're wrong, it's okay because I didn't know it either.
Is it A?
We'll see in a few moments. Let's see what's in the chat. All right, so Kelly says C, Love says C, Mila says B. I see it's torn between C's and B's. And I have something for you, everybody. We're learning something new today. The answer is D. And so, Shelby, would you read this response?
Lilies are extremely toxic to cats and can cause kidney failure if ingested, even in small amounts. Aloe vera, snake plant, and lavender can be mildly toxic, but do not pose as serious as a threat as lilies.
That's right. So there are some images there of different types of lilies. And again, you can always go back and refer to this video. But the best thing to do is to go to your vet's website, see what free resources they have, because there are some other information we have to provide to you too, such as those holiday plants. Those winter plants can be poisonous to your pets. So when you're decorating a house, you got to be careful if you have holly, ivy, snowdrops, poinsettias, or mistletoe, because if the pets ingest those, it can be poisonous. So be thinking about putting those plants away or just not purchasing them during the holiday season. Or even a better alternative is buying fake plants. Yeah. If you have to have poinsettias, don't buy the real ones. All right, so question number 11. This one is yours, Alexia.
What should pet what should pet owners avoid feeding their dog, as it can lead to severe
Gastrointestinal.
gastrointestinal upset and potential poisoning? Is it A, broccoli, B, chocolate, C, cooked chicken, D, peanut butter?
All right. So what do you think the answer is? This time I will call Damani. What do you think the answer is?
B, chocolate.
You think it's B, chocolate? And I think that everyone agrees with you. We have Miriam, we have Wilbur, we have Marcia, we have Love revealing the answer in 3, 2, and you all know how to keep your pets safe. I am so proud of you. Answer is chocolate. So chocolate contains theobromine, I hope I pronounced that correctly, which is toxic to dogs and can even cause vomiting, diarrhea, heart problems, and even death. So no chocolate for our furry family members. Question number 12. Which of the following plants often found in homes or gardens can cause serious health issues if ingested by plants? And this is one we haven't discussed yet. So we know not to have the holiday plants. We know not to have lilies around cats. But is it going to be tulips, mint, basil, or sunflowers? Oh, Kelly was fast. Kelly says B. Anyone else? All right, because I don't remember the answer to this one. So I'm going to reveal the answer in 3, 2, and Marcia says D. Kelly says B. Maria says B. It is A, tulips. Who knew, right? So tulips are toxic to pets, particularly the bulbs, which can cause vomiting, diarrhea, and irritation of the mouth and throat. Mint, basil, and sunflowers are generally safe for pets. All right, so now question number 13. I'm not sure who we left off on, so I'm just going to start off with you, Alexia. Would you read 13 for me?
You need to move a heavy dog that cannot walk due to injury. What is the best way to safely move the dog? Is it A, pull the dog by its collar, B, lift the dog by its legs, C, use a blanket or a large towel as a stretcher, D, grab the dog by the scuff of the neck and pull it?
All right. What do you think the answer is, Alexia?
C. C sounds like the best way to go about this.
Yes, I agree with you. Let's see what our team members in the comment area say. And I'm opening up the camera. Everyone said C. So let's actually reveal the answer. And the correct response is C. So great job, everybody. You want to use a blanket or a large towel as a stretcher. Remember, the rationale is that the safest way to move a heavy injured dog is to use a blanket or towel as a makeshift stretcher. This method provides support to the dog's entire body and helps prevent further injury. Lifting by the legs or pulling by the collar or scruff can cause pain or injury. All right, so this one is going to be yours, Damani.
What should you do if your dog shows signs of poisoning? Is it A, give it milk, B, induce vomiting immediately, C, wait to see if symptoms improve, D, call the vet or pet poison control?
Yeah, so what do you think the answer is, Damani?
D.
You think it's D? Let's see what our team members in the chat says. And we'll be revealing the answer in 3, 2, And that's right, Miriam and Chidi. I totally agree. And Maria, it is D. You're going to call the vet or poison control, pet poison control specifically, not just human poison control. The rationale is immediate professional help is necessary. Do not induce vomiting unless instructed by a veterinarian or poison control. And there we have the phone numbers for the poison control hotline, one of which is 888-426-4435, or another hotline is for the pet poison hotline or helpline, and that one is 855-764-7661. All right, so we just left off with Damani. So Zalexia, would you read 15, and then Shelby will have you read number 16.
For a pet experiencing seizures, what is the best first aid response? Is it A, hold them down to prevent injury, B, move objects away from the pet, C, put a spoon in their mouth, D, administer CPR?
All right, so let's see what they say in the chat. So what I find interesting about pet CPR and first aid is that it is so similar to human CPR and human first aid. So if you understand some of the basics of first aid techniques for humans, you're going to be able to keep your own pet safe. And so let's reveal the answer in 3, 2, and 1. And Alexia, would you please read the response?
B, move objects away from the pet. The rationale: never try to restrain a pet during a seizure. Move objects out of the way to prevent injury and call your vet.
And so one thing I will add that the vet will more than likely want to know is the time of the seizure. So if you see that your dog is having involuntary tremors, they're shivering, and they're not responsive, I want you to go ahead and mark the time that you notice the seizure activity, so that way when you call the vet, they'll know how long that seizure lasted. So you'll mark the time the seizure started and also the time that the seizure ended. All right, so question number 16, Shelby.
How can you help a pet with a broken limb before getting them to the vet? A, try to reset the bone. B, apply ice directly to the fracture site. C, let them walk it off. Or D, apply a splint or padding.
So, and then Mila has a question. I wonder what causes seizures in pets. So similar to humans, Mila, a seizure could be caused by drug overdose. So maybe they got a hold of some type of opioids or some drugs. Maybe they ate a brownie that was laced with something that maybe humans consume, but a pet shouldn't. And then if they have an infection, they can have a seizure. And if they get overheated, they can have a seizure too. So similar reasons why a pet would have a human, that pretty much corresponds with the reasons that humans have seizures. And looks like everyone says D. So Shelby, would you please read the response?
Answer D, apply a splint or padding. Rationale is embolizing the limb with a splint or padding will help reduce further injury and pain before professional care can be provided.
Yes, and this poor cat looks like he had a bad day at the job. So if you are a cat lover, please keep those cats safe. All right, so question number 17. When approaching an injured animal, what should you do first? Is it A, run towards the animal to help quickly? B, speak softly and move slowly towards the animal? C, stand over the animal and pet it immediately? Or D, approach from behind to avoid frightening the animal? So we have an animal that is injured. What do you think the safest option would be for you and for that animal? An injured, scared animal could bite you. So what do you think the best response is?
B.
Everyone said B. I am so proud of you. So it's going to be B. Shelby, could you read the response?
B, speak softly and move slowly toward the animal. The rationale is injured animals are often scared and in pain, so it's important to approach them calmly and slowly, speaking softly to avoid startling them. Sudden movements or approaching from behind can cause fear or aggression.
All right. And so, question number 18, team. What is the main priority when treating a pet with burns? Is it A, apply ointment, B, cool the burn with water, C, wrap the burn with gauze, or D, give pain medication? And we'll reveal this answer in about 5 seconds because this should be super easy for you all. Not only are you great human caregivers, you're great caregivers for your fur babies and also for your clients' animals and pets. So, revealing the answer in 3, 2, and if you chose B, cool the burn with water, you're absolutely correct. And so, if you don't have running water, guess what you can use? So, let's say you're at a park, you're at an event or something, and there's not running water, such as just what happened in some of the areas impacted by the floods. If you can take a bottle of water and pour it over the burn area, that will help to cool it. So cooling the burn with cool water, not ice, helps to reduce the severity of the injury. Ointments or medication should only be given after veterinarian guidance. And so M. Morgan says, I have a 16-year-old dog named Sandy P. And so I wish we could see a picture of Sandy P. Question 19. If an injured dog growls as you approach it, what should you do? Is it A, continue approaching as the dog is just scared? B, shout at the dog to calm it down? C, run away immediately to avoid getting bitten? Or D, stop, give the dog space, and assess the situation? I would probably do the wrong thing. I could see myself running away immediately and getting chased. So we all know that C is not the correct response. The correct response, that's right, everybody, is D as in dog. All right, so would you please read this for me, Zalexia?
Stop, give the dog space, and assess the situation. If an injured dog growls, it is feeling threatened or in pain. The best course of action is to stop, give the dog space, and reassess how to approach. Forcing contact could result in the dog biting out of fear or pain.
That is right. And so this one is going to be yours, Damani. Would you please read question number 20?
Which of the following is an appropriate way to perform rescue breaths on a large dog? Is it A, blow air directly into its nose? B, blow air into its mouth and nose together? C, blow air only into its mouth? Or D, hold the dog upright and blow air into its throat?
All right, so let's see. What do you think? So we have a dog who is having a hard time breathing. It is a large dog, and we have to perform rescue breaths. What do you think the best response is? We want to save the dog. We want to give it oxygen until those rescuers come. And when the rescuers come, they can provide additional support. So we're going to reveal the answer in 3, 2, and looks like we have a lot of C's. And for this one, it is B, everybody. So what you're going to do is you're going to actually close the mouth and the snout. So for most of your dogs, your medium and your large size dogs, CPR would not be mouth to mouth, referring to the breath. It's mouth to snout. So you close the mouth, make sure the tongue is in place, and you put your mouth over their nostrils. So it's going to be A. You can blow air into the mouth and the nose together if your mouth can do so. Otherwise, close the mouth and blow it directly into the nose. And so that would be the best response. If you have a smaller dog, let's say like a pup, then of course you can put your mouth on top of their nose and their mouth. I know, right? If you really love your pet, you're going to do it. I'm just not going to tell you that I would. Question number 21. How long should each CPR cycle last before rechecking for a pulse and breathing? Think of human CPR. Is it A, 1 minute, B, 2 minutes, C, 5 minutes, or D, 10 minutes? How often do you perform a pulse check? And I see some correct answers coming through. And we'll reveal the answer in 3, 2, and if you chose B, 2 minutes, you're absolutely correct. So after 2 minutes of CPR, reassess for a pulse and breathing. This helps determine if additional resuscitation efforts are necessary. And question number 22 will be yours, Shelby.
Which of the following is not a sign of respiratory distress in pets? Is it A, rapid breathing, B, blue or purple gums, C,
Lethargy.
lethargy, or D, excessive drinking?
All right. And so, everybody, I'm so proud of our interns. They've been with us now for about 4 weeks. Not only are they learning medical terms, presentations, video production, editing, how to use AI. Let me tell you all, one of the best things is that they're all just teenagers. So imagine how strong, how awesome they're going to be in a few years. They're already awesome now. They're just going to be awesomer. Not sure if that's a word, but Nurse Eunice said it's a word, so it's a word today. All right, so revealing the answer, everybody, in 3, 2, and 1. Shelby, what's the correct response?
D, excessive drinking. While rapid breathing, discolored gums, and lethargy are signs of respiratory distress, excessive drinking is not typically associated with respiratory issues.
Awesome. And so now we're on, I think we have 30 questions. So I'm so proud of you all for hanging with us and learning about pet emergencies and how to help an injured cat or dog. So question number 23, what should you do if a pet has an open wound and is bleeding heavily? Is it A, wash the wound with water, B, apply direct pressure to the wound, C, apply a tourniquet, or D, allow the wound to drain? And for this one, I will accept 2 different answers because I believe that 2 answers could be correct. All right, so what do you think it is? Looks like I showed you the answer. All right, so let me go back because it's just not B. It could be B or it could be C because it says they have an open wound that is bleeding heavily. So you want to initially start off with direct pressure. And then if direct pressure does not slow down the bleeding, that is when you would consider using a tourniquet. And you can make a makeshift tourniquet with a cloth. You can make it with a t-shirt. You can make it with a bandana. So there are different ways in which you can tie off the circulation. But, because we don't want the blood to keep flowing out. But again, just like with a human, you want to time. You want to let the vet know what time you applied this tourniquet. You don't want to be releasing it because if you release it, you're going to cause the wound to bleed more. So now we're on our next one, and it's going to be you, Alexia. Question number 24.
How should you position a pet that has gone into shock? Is it A, keep them standing, B, elevate their head, C, elevate their hind legs, or D, lay them on their back?
Good question. So shock can be caused from blood loss, dehydration. It could be caused from an injury. Let's say it was hit by a vehicle and the animal is internally bleeding. So if an animal goes into shock, what do you want to do? Let's say it's shock from a non-traumatic illness or condition. So if they're dehydrated, what do you want to do? If you chose C, elevate their hind legs, you are correct because elevating the hind legs help to promote blood flow to vital organs, which is crucial for stabilizing a pet in shock. And then once you get the animal to the vet, they're going to start IVs. They can fix any wounds. So you're just doing the first line treatment until we can get more help at the veterinarian. And so if you stayed this far, and it looks like we have a lot of our loyal viewers here, and I appreciate you. So as you stayed this far and you haven't already liked the video or subscribed to our channel, go ahead and do so. Tonight's video was more, just fun. I want to make sure we introduce our interns and give them an opportunity to participate in one of the videos that they create. They create so many videos for us. They're behind the scenes. And this time I just wanted to acknowledge them and bring them, present them to you. Question number 25. How can you protect yourself when moving an injured dog that may bite? Is it A, hold the dog's head tightly while moving it? B, avoid eye contact and move the dog without any precautions? C, cover the dog's eyes with your hands? Or D, use a muzzle or wrap a towel around the dog's mouth? How do you protect yourself when you're trying to move an injured dog? You don't want to get bitten, so what do you want to do? And I hear the geese. All right, so looks like checking the chats now. Looks like we have a D. Let's see if we have any other responses. Revealing the answer in 3, 2, and yes, Mila and Miriam, if you selected D, use a muzzle or wrap a towel around the dog's mouth, you are correct. We do this to prevent the dog from biting. Injured animals may bite even if they are usually calm, as they may become scared or in pain. Never hold the dog's head tightly, as this could worsen its anxiety. And now looks like for question number 26, we're on you, Damani.
What type of bandage is best for a pet with a sprain? Is it A, a tight non-elastic bandage, B, a compression bandage, C, a loose bandage, or D, no bandage at all?
All right. And so, so we're trying to bandage a pet that has a sprain. All right. So a muscle is pulled. And do you want to use a tight, non-elastic bandage? So that means that the bandage doesn't stretch. Do you want to do B, a compression bandage, C, a loose bandage, or D, no bandage at all? And I see C's and I see D's, and I love being able to introduce you to new information. And so don't be afraid of a compression bandage, because a compression bandage is used to compress. So it's elastic, but it kind of decreases the swelling. So the correct response is going to be B, a compression bandage. And so a compression bandage provides support to the sprained area and reduces swelling without cutting off circulation. If you just have a loose bandage, well, pets, it's just going to fall off of them. So how do you determine tightness? Whenever you're putting a bandage or anything on top of on a person's skin or animal skin, at least try to get 1 or 2 fingers between the fur and the bandage. And if you can get 2 fingers through, there's enough room for circulation. So it doesn't have to be loose. It just can't be extremely tight. All right, so this one is going to be yours, Shelby, 27.
How can you prevent a pet from becoming overheated on a hot day? Is it A, walk them during the hottest part of the day, B, provide ice cold water constantly, C, shave their fur completely, or D, limit outdoor activity to early morning or late evening?
And our students and our viewers are super smart, so I know everyone's going to get this answer correct. And so I'll reveal the response in 3 seconds. 3, 2, and yes, it is D. You want to limit outdoor activity to early morning or late evening. Don't walk your pets when the concrete's 100 degrees outside. So walking pets during the cooler parts of the day helps to prevent heat stroke. Shaving or ice cold water is not necessary and could cause other health issues. Zalexia, question 28.
How can you check if your pet is dehydrated? Is it A, by looking at the color of their eyes, B, by pinching their skin on their back, C, by checking their paw pads, or D, by listening to their heartbeat?
All right, and let's check the chat. So let's see what the responses are. And our viewers are amazing. If any of you all have recently gone to our website to try to download any of our free study guides, we updated our website. So now to get to our study guides, you go to resources, and then beneath the resources tab, you'll see study guides and more. And that's where you can get all of your free study guides, etc. And so for question 28, Zalexia, what is the correct response?
The correct answer is B, by pinching the skin on their back. If the skin takes longer than usual to return to place after being pinched, the pet may be dehydrated.
Awesome. And question number 29. What type of litter is generally considered safest for kittens? Is it A, clumping litter, B, clay litter, C, silica gel litter, or D, non-clumping natural litter? And before making this video, I did not know there were so many different types of litter for our cats. So if you are a cat lover, what is the best type of litter that is safest for your kittens? And we'll reveal the answer in 3, 2, and I see correct responses. And Mila, because your answers always come up first, and I see you're viewing from YouTube. So it seems like the viewers from YouTube, your answers come up faster than those from Facebook. So the correct response, everybody's correct, is D. It is non-clumping natural litter, such as those made from paper or corn, are safest for kittens. Clumping litters can be harmful if ingested, and some other types can create dust or cause respiratory irritation in young animals. And then question number 30, Shelby, would you read this one?
Which of the following is a potential health risk for humans when cleaning a cat's litter box? Is it A, exposure to
Ammonia.
B, allergic reaction to the litter,
And
C,
then C is toxoplasmosis.
toxoplasmosis, or D, none of the above?
All right. Do you know what the response is, Shelby? Have you heard of any of those terms before?
No, ma'am.
Okay. So let's see what our viewers have to say. So you want to be very careful when you're cleaning out a cat's litter box. If not, you could be exposed to C, toxoplasmosis, which is a parasitic infection that can be transmitted through cat feces. So pregnant women and individuals with weakened immune systems should take special care when cleaning litter boxes, as toxoplasmosis can pose serious health risk. And I see everybody in the chat got it right. And so please take us home. Alexia, would you please read this slide?
Guess what? You are a savior. Thank you so much for watching and joining us today. We want to congratulate you on being amazing caregivers, not only for your pets, but for all the lives you touch. Your dedication to learning and improving your skills make a real difference. We were proud to be part of your journey. Keep up the great work.
All right. And so you all know how we like to end our videos. Of course, I'm going to stay hang around because I know Mila has some questions. And so I think on Friday evening, we'll be doing a video, and don't be disappointed if I change the topic. But on Friday evening, I think it's going to be pediatric illnesses and emergencies. And then on Saturday morning via Zoom, which I haven't forgotten, I'll make sure I post in the community section. That's when we'll be doing our managing medical emergencies video. And so what are your final thoughts, please? I know it was nerve-wracking for our interns to get in front of the camera. They're used to being behind the camera. So if you can please, just give them a thumbs up, let them know how much we appreciate them.